What's up, y'all? My name is Jafar Al-Kanani. I'm a doctor of physical therapy, athletic trainer, and teaching assistant for anatomy. And I often get asked if there's something that I would recommend to go over before the first day of class. And I think this depends on every anatomy class. Some go faster than others. But if you're going to be at a graduate level, maybe you're doing dissection as well, and you want to know a couple things before your first day to make sure that you feel a bit more comfortable, I would say it's really useful to have a good grasp on anatomical terms of both movement and location. That way, if these are things that you don't really know very well, you can be a little stressed out. So if you know these things, then that takes that stress away. You can use these terms correctly and you can focus on learning the correct techniques, the muscles, the bones, rather than focusing on just the terms you're using to describe them. So that's what we'll go over today. So the first terms to go over are for location. And the first two that we're going to do is anterior, which is the front of the body, and posterior, which is the back of the body. Now, often these terms get used also in the term of like a view. So this is an anterior view. And then if you were looking at the back, it would be a posterior view. So sometimes you might look in a textbook or an image and you might think to yourself, oh my God, what am I looking at? And knowing that it's an anterior or posterior view can be very helpful. The one area of the body where this gets complicated is at the forearm because of anatomical position, which is the position anatomists have decided is the end-all be-all position for these terms. Anterior is the palm side. So when you go like this is anterior in the front. But the back of the hand, that's posterior. So you see here, that's anterior, and here that's posterior. But for the entire rest of the body, it's pretty straightforward. Front, anterior, back, posterior. All right, so this is the second two terms is the medial and lateral. And this is super janky, but what I'm trying to say here is that medial is in midline. So the midline is if you cut the body in half, front to back, so anterior to posterior, if you cut the body that way, right in the middle, that's the midline. So anything that's closer to the middle is medial, and anything that's further away from the middle is lateral. So you see lateral is on both sides, and you see medial is on the middle. And the way that people get confused with this is that sometimes they think there's like multiple midlines. The arms and legs don't get their own midline. There's only one midline. So because of this, when we talked about the forearm earlier for anterior and posterior, remember the front is anterior. The inside of your forearm would be medial. So if you have your palm in front, this would be medial and this would be lateral, right? The middle of your forearm doesn't get its own midline. It's still lateral out here, medial on the inside. And so the other way that this is used, similar to anterior and posterior, is a lateral view. So sometimes in a textbook, you might have an image, or sometimes x-rays, they'll have a view from the side, and then you know it's a lateral view. Medial views, I don't think happen very often. Maybe they do, but usually you hear about lateral views, and you hear these terms be used to like describe something in comparison to something else. Maybe you're doing cadaver dissection and you're looking for something, and your professor comes over and says, hey, you're a little too lateral, look more medial. So that's a way these terms get used. So we have anterior front, we have posterior in the back, we have medial in the middle, lateral to the outside. All right, so the next two are superior, which is up by the head, and inferior, which is down by the feet. So superior means up, inferior means down. So something that's more superior is higher up or closer to the head. Inferior is further away, closer to the toes. So the most inferior thing would be your toes. The most inferior part of your upper extremity, which would be your fingertips. The most superior part of your upper extremity would be your shoulder, so on and so forth. So just to go over what we have so far, we have anterior front, posterior back, medial midline, closer to the middle, lateral away from midline, so out to the side, superior up by the head, inferior down by the feet. All right, so next up is proximal and distal. Now these two terms only really refer to the extremities, so the arm or the leg. Proximal just means closer to the torso, distal means away from the torso. So the most proximal part of the upper extremity is the shoulder, and the most superior part of the upper extremity is also the shoulder. So you have two ways to describe that. So proximal, closer to the torso. Distal is farther away from the torso. So the wrist is more distal than the elbow, and the elbow is more distal than the shoulder, so on and so forth. So the most distal aspect of the upper extremity are the fingertips. The most distal aspect of the lower extremity are the toes. So just to go over again, we have anterior front, posterior back, superior up, inferior down, medial midline, lateral away from midline, proximal close to the torso, distal away from the torso. There are a bunch of other anatomical terms. caudal, rostral, ventral, dorsal. But I think that those are maybe, I mean, it depends where you are, but oftentimes less commonly used. And if you just have that basic set, which we went over, I feel like you'll be able to pick up the other ones fairly quickly because they often are somewhat synonymous. Maybe that's a topic for another video where we can go about the specifics of those. But with that set of terms, you'll be able to describe locations very well. And I think will be very useful, especially if you're in your dissection lab and you need to describe what you're looking for, where you can find things. Super helpful. The next thing that we're going to go over, though, are movements. And we're definitely not going to use these papers for that. Okay, so for these movements, we're going to go super quick, and you can follow along at home, maybe watch this a couple times. And we're going to go joint by joint. And so the first one that is the classic joint for these is the shoulder. So we have flexion, raising the arm up. We have extension, bringing the arm back. We have abduction, which is bringing it up to the side. We have adduction, so 2 Ds. If you look at this written out, 1 D going up, 2 Ds going down. Abduction, adduction, flexion, extension. The next one you have is external rotation, internal rotation, also known as lateral rotation or medial rotation. External rotation, internal rotation, flexion, extension, abduction, single D, adduction, 2 Ds. So 2 ducts going down, 1 duct going up. So those are terms that are very useful to know. Then you have the shoulder blades, and these shoulder blades are locked down here, so I can't show you, but I'll show you on myself. You have elevation, depression, protraction, retraction. So protraction, shoulder blades going forward, retraction, shoulder blades going back, elevation, shoulder blades going up, depression, shoulder blades going down. You can get way more complex with the shoulder blade movement, but I think just with those 4, you'll be good to go for the most part in the beginning. Next one is elbow. You just have flexion, extension, pronation, supination. So you have pronation, supination. If you're in the club and you're showing everybody the dance moves, it's that pronation that gets it, and then the supination. So we have flexion, extension, abduction, single duct, adduction, 2 ducts, external rotation or lateral rotation, internal rotation or medial rotation, and that's for the shoulder. Then you have flexion, extension, pronation, supination. Okay, now we have the wrist. Similar stuff. Flexion is the same direction. So you think about flexion. Flexion is always just going like this. They're all going in the same direction. So shoulder flexion this way, elbow flexion this way, wrist flexion this way. So wrist flexion. Okay, wrist flexion, wrist extension. So flexion, extension. Then these ones, they get their names from the bones. So you have radial deviation, ulnar deviation, radial, ulnar, radial, ulnar, radial deviation, ulnar deviation. All right, so that's the upper extremity. Now we're going to do the spine. Now, Jimmy Bones is really not very flexible, so I'm going to show you on myself. You have, again, flexion going forward, flexion, extension going back, lateral flexion to the side or side bending. Then you have rotation, right? So flexion, extension, lateral flexion, rotation. All right, now we get the hip. Very similar to the shoulder. You have, so we talked about flexion, extension going back down. We have internal rotation. So that's the leg turning in like this, external rotation, leg turning out like that. And that's also called medial and lateral rotation. God, this thing is made by people who don't like skeletons to move. My goodness, holy crap. Okay, then you have the knee. The knee, it extends and flexes. You see that? It extends and flexes. Extends and flexes. So extension, flexion. I don't know why I had to tell you that 100 times, but there you go. And then you have dorsiflexion and plantar flexion. So pointing the toes, gas pedal, that's plantar flexion. Dorsiflexion, the opposite of a gas pedal, that's dorsiflexion. So dorsiflexion, plantar flexion. Then you have other ankle stuff we don't have to go into. There's more wrist stuff and finger stuff. We don't have to go into that. That's more specialized. I think if you know just those general motions, honestly, first day of anatomy, you'll probably be fine. And if you don't break the models, you'll also be fine. So there you go.